Hello, and thank you for joining today's town hall. Today we'll be using the Q&A feature for questions. If you have questions that you would like one of our presenters to answer, please enter it there. You can find this at the bottom of your screen with the Q&A and a little call out symbol with a question mark. Thanks again for joining, and we'll get started in a few minutes. Hello, and thank you for joining today's town hall. We're going to begin shortly. Hello, thank you for joining today's town hall. For those of you who've just joined, we're going to be using the Q&A feature for questions. You can find that at the bottom of your Zoom toolbar. It's a call out symbol with a question mark. Q&A is listed right underneath it. We'll do our best to work through questions during today's town hall. And we are still seeing the numbers go up a little bit. Mitch, do you want to just give me a signal when you want to begin?
Sure. I think we are at 5 after, so I think it's a good time to start.
Okay.
So we'll take it over. Thanks, Amy.
All right. Thank you.
Hello, everybody. Good afternoon, and thank you for joining us for our first provider town hall of 2024. My name is Mitch Fash, and I'm the Senior Network Manager here at Magellan. I want to thank everybody for taking the time for joining us today. I'm looking through the list of names, and it's good to see so many people that I'm familiar with join us. And I'm glad that you continue to participate in these. We hope to hit the topics that you're looking to hear some updates on. We will be sending out the PowerPoint and recorded presentation after today's town hall. We should be sending it out actually by the end of this week. So you'll have the ability to look through the slides and have all the materials at your fingertips. We will be launching an exit poll survey. It will be launched right at the time I do the network updates. I will remind you right before it launches. We really would like you to take a couple minutes to answer the questions. It helps us plan for future town halls and future topics that you have interest in. So please, again, take the moment. Don't try not to drop off if you can hold off and complete that survey. So again, welcome everybody. I'd like to start by going through our quick agenda here. So we will have some organizational updates from our CEO, Jim Leonard. We'll have clinical updates, some quality improvement updates, compliance, and then again at the end, I'll be coming back and doing some network updates. So we will start our presentation today with some organizational updates presented by Jim Leonard, our CEO. Jim?
Thanks, Mitch, and good afternoon, everybody. Mitch, you can forward to the next slide. Okay. Wanted to take a few moments to provide some information about what's proven to be a little bit of a challenging year this year for Magellan and all the BIMCOs and primary contractors throughout the Commonwealth. Throughout the year, we've been experiencing unprecedented rate pressure and rising cost of care issues, and specifically related to the program capitation rates. So wanted to provide a little bit more context, share some of the steps that we've been taking to address the rate issues, and then talk about future impact and our plans for 2025. So, as you may have heard, we've seen a pretty significant increase in behavioral health costs. And when we've dug in and done some analysis around the drivers, a few primary factors are really impacting the trends. First of which is the decrease that we've seen in membership. And I think as the MA unwinding process played out, many had expected membership numbers to level off in the program towards the end of last year. That ultimately was not the case. And going into the first part of 2024, month by month, each county where we operate experienced a pretty significant decrease in their overall membership. When we compare membership in the program for the first part of 2023 to the comparable period in 2024, it's been about an 18% reduction in membership. So that is significant. Second, for the members that remained in the program, we've seen a shift in the overall population acuity. In other words, members that remain in the HealthChoices program are more likely to utilize services, a higher intensity of service, and a higher degree of service compared to the individuals that left the program. Not really a surprise. These are people that we would expect would need the support of the HealthChoices Medicaid program, but it really has had significant impact on care trends, care cost trends. And then finally, another impacting factor are the rate increases that we had rolled out a pretty comprehensive set of rate increases across the network in 2023. And so what we've seen is the impact of those increases as we've managed costs for the program this year. All of this has really resulted in year-to-date medical spending that is, at this point, trending over 100% our anticipated medical costs. And so in order to address this, Magellan, the counties, and actually all BIMCOs throughout the Commonwealth and counties have requested the opportunity for a mid-year capitation rate adjustment from OMSAS. There is language in our contracts that allows for this type of mid-year request should a rate adjustment be necessary. And so we were able to share a lot of the analysis that we had completed along with year-to-date financials that OMSAS and Mercer, their consultant, will be using to formulate some conclusions and hopefully a support offer. So we are still waiting for formal response from OMSAS. Actually, timely, we did receive communication from the department yesterday that additional information should be forthcoming shortly. We recognize that in our strategic plans, we had identified an opportunity to look at kind of across the board cost of living increase for providers. And so we recognize we want to get information to all of you as soon as possible. However, we really need to get confirmation of how things are going to play out for this mid-year rate adjustment request. Additionally, right now we're in the process of discussing 2025 program rates, and that will have impact on our future rate planning for the program. We expect to be able to get back to all of you, hopefully by the end of October, with more substantive information about the plan for cost of living adjustments. But in the meantime, please continue to send us information and data that you have been sending in that supports your program needs. And as always, the primary contractors in Magellan are going to continue to advocate for what the program needs to really remain successful. Okay, on, I guess, a little bit of a lighter note, before I turn the program over to one of my colleagues, I just wanted to mention that Magellan is going to be getting ready to issue our annual provider satisfaction survey. Actually, I stand correction. It was launched already on September 9th, so a couple weeks ago. That will remain open until October 10th. So just a plug. We find this information extremely helpful, really has shaped future planning and practices. So please take the time to respond to the survey and get that in before the October 10th deadline. Okay. From here, let me turn the program over to Anita Kelly, our clinical contract advisor, who is going to share some updates from our clinical team. Anita?
Thank you, Jim. Hello, everyone. Hope you're all having a good day. I wanted to provide some updates on the ASAM alignment review process. So Magellan has been through our first and second round of alignment reviews in the 3.0 levels of care. And we've scheduled most of the third reviews that will occur in the last quarter of this year. We have done a couple third reviews. Starting in 2026, we are being told that we will start the ambulatory levels of care reviews, which would be the partial hospital programs, the IOPs, the outpatient programs, and the MAT clinics. So that is new, and more about that as that is rolled out. But we are seeing an improvement in the ASAM alignment. It's evident by the numbers that we're seeing. We're glad to see it. I think all of our providers are really making a concerted effort to really be aligned with the ASAM criteria. If anyone has questions or needs assistance, I just want to say, please do not hesitate to reach out to me. Everyone should have my email address, and also we have an ASAM email address that will be available to you that I monitor. So please just ask for help. That's what I'm here for. And the Train for Change program actually presented an implementation series that was available for all providers. It was a 4-week process, and or I should say a 4-series process that it was recorded, and it should be available on the DDAP website. And the Train for Change program gave great instruction on how to implement ASAM throughout your entire program. And in addition to that, DDAP offers technical assistance meetings on the first Monday of every month. Each month, they cover a different topic. It's really great information. I highly recommend that you attend. And DDAP sends out the link for that for the entire year. Even though we are doing the 3.7 alignment reviews, and we will be doing the 2.5 alignment reviews, anyone who is a 3.7 or 2.5 provider of care must first get the green light from DDAP. And there is a complete list of 3.7 and 2.5 providers who have been green lighted and have the go ahead to practice in that capacity on the DDAP ASAM website. So be sure to check that out. And I also wanted to provide some updates on our opioid centers of excellence. So on August 1st, the fidelity guidelines were published. Everyone who is a COE or owns a COE should have received those. If you haven't, just let me know. I will forward those out to you. Each program has until February of 2026 to make full implementation. So that is a full year and a half, which is, I think, a really sufficient amount of time. We will, at Magellan, we will continue to hold our monthly meetings for now. But after the guidelines are fully implemented, we will consider moving those meetings to every other month, as we do hold quarterly data meetings for each individual COE. And right now, I'm holding implementation guideline meetings by county for our COEs. So if you missed one, let me know. I'll be happy to include you in another. There will be 3 meetings per county. And some counties have attended the first session. Others are already scheduled for this month. Yeah, so if anyone has any questions about the implementation of these fidelity guidelines, again, don't hesitate to reach out about that or ASAM. So I will pass this on to my colleague, Courtney McDermott, who is the supervisor of the care coordination team. Take it away, Courtney.
Go ahead, Mitch, and forward to the next slide. Thank you. So my name is Courtney McDermott, and I am the supervisor for our care coordination team. And today I will be providing a brief overview of our community transition coordinators. So our CTCs work with our members who are experiencing a behavioral health hospitalization and the social workers for our inpatient providers to coordinate any needs for our members during the discharge planning process. Our CTCs meet the members on unit to identify behavioral health service needs, any social determinant of health needs, and assist to provide linkage to community-based resources and services for our members. CTCs also work to assist the social workers in establishing a connection to any existing community-based providers that our members may have to assist in facilitating coordination of aftercare for that member. So the primary goals of the CTC team are to increase aftercare follow-up rates, decrease readmission rates, and to assist our members in maintaining community tenure. Go ahead and forward to the next slide, Mitch. So our CTCs are all about making member-focused connections. Again, we meet the member during their inpatient stay to identify needs and link with any appropriate resources. We follow up with the member after their discharge to ensure that the connection has been made to their aftercare provider, and also ensure that any connections are being made to community-based resources if needed by the member. Magellan CTCs also assist our members that outreach to Magellan that are looking for assistance in connecting to community-based service providers, and we also outreach to our members who experience a visit to the ER but have been discharged without AIP placement, just to offer assistance in linking to any behavioral health services if needed. Go ahead and forward to the next slide. Thank you. So our Magellan community transition coordinators and established inpatient providers that we work with, we have Danielle Kaplan, who assists at Horsham and Lower Bucks Hospital. We have Josie Lehman Jango, who assists at Belmont, Brookland, and Fairmount. We have Jim Marchetto, who assists at Kids Peace and St. Luke's. And then I assist at Conemaugh Memorial Medical Center. So if you have any questions, please feel free to contact me. I thank you for your time, and I will now be passing it to my colleague, Austin Hoffman, for some quality improvement updates.
Thanks, Courtney. As you can see, the first slide had Maria Burkelli-Pigeon identified as the presenter. I'm obviously not her, but happy to be here with you today. I am a quality improvement reviewer that works with Maria on the QI team. So for quality improvement, we have a couple of topics we'd like to discuss today. The first of these are the clinical practice guidelines. CPGs are a universal system, not just relevant to behavioral health. They are based on scientific evidence, reviews of medical and psychiatric literature, or appropriately established authorities, and they provide additional guidance while licensing regulations only establish the minimum standards. So when we think about the words clinical practice guidelines, we want to associate them with evidence-based practices. So these are meant to help guide providers and members in making healthcare decisions. These evidence-based practices are developed and based on data-driven research and findings. Magellan develops or adopts these clinical practice guidelines to assist providers in screening, assessing, and treating common disorders. Prior to adopting each guideline, a multidisciplinary panel, including board-certified psychiatrists and clinical staff, examine relevant scientific literature and seek input from our network providers, as well as consumers and community agencies. Once implemented, Magellan reviews each guideline at least every 2 years for continued appropriateness and updates them as necessary. Next slide, please. So now we're going to talk about general performance improvement opportunities that include and expand on the CPGs that we just discussed. So the list of CPGs on the screen are the ones that Magellan has adopted and are listed on our provider website. These CPGs do have limitations. Although we are using the most current research to develop evidence-based practices, there are still other factors that come into play when choosing the appropriate treatment path. As a whole, we still need to consider individualized treatment needs. So again, the CPGs serve as a reference guide, but are not a final determination for appropriate treatment steps. Next slide, please. So the data on the screen represents outcomes from the CPG treatment record reviews. Through the TRR review process, Magellan explored if providers had implemented national CPGs for use with our member population. These results are expected to be greater than 85%, and those not meeting the goal were addressed via action plan. So we can see here the 85% benchmark was met across 3 of the 5 audit tools. SUD was not met at 80%, and ADHD was not met at 75%. We saw increased scores in 2023 for major depression, schizophrenia, and suicide risk, and we saw a decreased score for ADHD. Main objectives of CPG monitoring include assessing performance against the CPG components, measuring current evidence-based diagnostic and treatment practices and recommended intervention criteria, identifying areas of strength and opportunity in provider compliance with the CPGs, and designing appropriate training interventions to increase compliance. Next slide, please. So on this page, we've included directions for the locations on our provider page where the CPGs are stored. so feel free to access these freely and often as they do change. Next slide, please. We also wanted to share and remind our network providers that the Magellan of PA website hosts other resources under the quality improvement section. The provider performance standards are another helpful tool. These are guides developed by Magellan to share expectations of providers for services that are offered. These standards may include items that are referenced on treatment record reviews, so it's important to have familiarity with these and to review them as they are regularly updated. Magellan notes when these standards are updated so that providers can be aware of any changes. Next slide. The behavioral health screeners and outcome tools on the quality improvement section of our website are also helpful evidence-based resources for providers to be familiar with, so I would recommend checking those out as well. Next slide, please. And now we wanted to share a bit about upcoming opportunities and resources, so thanks for hanging in there with us so far. Magellan will be hosting the front-end customer service quality improvement activity in the fourth quarter. Magellan staff will be calling provider locations to experience and assess firsthand what the member experience is when making an initial call to a provider. Providers will receive feedback on their performance. We also encourage all programs to routinely complete similar activities as quality assurance measures to promote positive customer experiences. Next slide, please. Another friendly reminder, providers may receive outreach from Consumer and Family Satisfaction or CFST teams requesting participation and support to assist with member experience surveys. This is part of the program standards and requirements for HealthChoices in Pennsylvania. Some of the programs that work with Magellan contracted counties include HopeWorks, Voice and Vision, and Recovery Partnership. If you have any questions about this program, you can contact the QI Director, Maria Burkelli-Pigeon. Next slide, please. Also wanted to use this time to remind everyone of our wonderful QI newsletter. This is a good way to stay current on any updates, upcoming trainings, and Magellan's quality improvement projects. The archive of these newsletters are posted on the Magellan of PA website under the QI section. Next slide, please. We want to take this time also to thank all of our network providers. We'd like to share the news that Magellan has received the Health Equity Accreditation from NCQA, and this is a great honor for us and our providers. We couldn't have done this without your help and support. Please share the good news with your teams, and thank you for your continued partnership and support. Next slide, please. And last but not least, Magellan would like to take a moment to recognize a few individuals from our provider community. Earlier this year, we implemented a program at Magellan for our staff to share situations where they felt providers had gone above and beyond. Next slide, please. So these individuals were identified in the first half of the year. So Magellan would like to extend a warm thank you to the following individuals for their demonstrated commitment to our members and the community. First, Stacy Spat and team at Lehigh Valley Hospital Acute Inpatient Program. They were serving a member who had no government-issued identification, which created significant barriers to transition into the community. The hospital team went above and beyond, assisting the member with the immigration process and with obtaining proper identification. Their advocacy and support even included taking the member to required in-person biometric appointments and enlisting the help of a legislative representative to provide guidance and resources. Next, we have Andres Ruccelli, psychiatric coordinator at Lenape Valley Foundation's outpatient program. He helped in a pinch responding to a call from Magellan with an adult member who had SPMI and called Magellan in distress, experiencing severe symptoms and having run out of medication. Magellan contacted Lenape Valley Foundation, and Andres quickly connected the member with a psychiatry visit that same day and also set up an evaluation for case management services. Sam Quorum, the administrative director from Vision Behavioral Health Services IBHS program, devoted over 2 hours of his time to help a parent complete intake-related paperwork, which enabled their child to quickly initiate IBHS services. David Moore, the Director of Performance Improvement from Malvern Treatment Centers, is a star with incident reporting. He provides complete and detailed information in incident reports, and his thoroughness eliminates the need for multiple follow-up emails, streamlining the communication process. It's also evident that the team reviews each incident immediately and takes swift action to improve any identified opportunities during their internal review. Maggie Spoor, Counselor for Resources for Human Development, Halfway House, does an excellent job of coordinating with local mental health providers to meet the needs of their members. Maggie is also very knowledgeable and always well prepared for reviews. And then apologies here for someone that got left off this slide but did receive kudos. We have Virginia, Counselor Virginia Ent at Gateway House, Halfway House, has done outstanding work with our members who had substance use disorder, mental health conditions, as well as autism. The member has made such amazing progress from initially being on a behavioral contract to getting ready to complete Halfway House services successfully and move on to the next step of their recovery. So everyone take this time here to clap or react below and congratulate these individuals for the wonderful work that they've done. So thank you for your time reviewing these updates with the quality team. I'm going to pass it over to Carly Schilling for updates about compliance.
Thank you, Austin. All right, you can go to the next slide. So just going to start off today with an announcement about our upcoming Provider Compliance Forum. This is an annual training that we offer for all of our in-network providers that focuses on compliance best practices, fraud, waste, and abuse oversight, documentation, billing reminders, auditing. We always talk about recent audit trends and any other important compliance topics. So this year's training is scheduled to take place on Friday, October 18th, starting at 10 a.m. It will take place by Zoom, and you must register in advance. After you register, you will receive a confirmation email containing information about joining the webinar. So the registration link is included here on this slide, which you'll have access to once the PowerPoint is shared later this week. But if you want immediate access to it, it was included in our August compliance email blast that we sent to providers. And that can be found on our Magellan of PA website if you navigate to the compliance alerts. All right, next slide, thank you. Shifting gears now, just wanted to move into some reminders about third-party liability. So third-party liability, or TPL, refers to the law which states that all other available third-party resources must meet their legal obligation to pay claims before the Medicaid program can pay for services for an individual that's eligible. So providers are responsible for checking member eligibility, including the presence of other insurance throughout a member's treatment. And if you do become aware that a member has another insurance benefit, which is not in their record, you should report it immediately to Magellan and also update or ask that the family update their eligibility information with the appropriate county assistance office. If as a provider, you're not contracted with that individual's other insurance plan, you must refer the member back to their primary health plan to find an in-network provider, unless of course they have a out-of-network benefit with that plan and there's an agreement in place. Generally speaking, you cannot bypass another insurance benefit to utilize a Medicaid benefit to provide services to an individual. It's also against regulations that to bill members for the difference between the reimbursement you would receive from Magellan and any other third parties and your standard rate. This practice is referred to as balance billing, and it's not permitted. It's also against Medicaid regulations and your Magellan contract to charge any sort of out-of-pocket costs to members, including any no-show or missed appointment. Go to the next slide. Thank you. So that intro slide to TPL is a good segue into a review about Act 62. So earlier this year, we sent a compliance communication to providers reminding them about Act 62. Just as a reminder, Act 62 was a 2009 state mandate that required private insurance companies to pay up to an annual limit per year for diagnostic assessments and treatment of covered individuals who have autism spectrum disorders. So in line with the prior slide that I had just reviewed, that means that Magellan is required to ensure that that member's primary insurance coverage is billed and those benefits are coordinated. And this must occur before Medicaid can be reimbursed for services that are otherwise the responsibility of a primary payer. So DHS has identified a list of procedure codes that reflect services for the diagnostic assessment and treatment of ASD that may be subject to Act 62. There are many services that are impacted by Act 62, which includes IBHS, ABA, and other children's services. Next slide, please. So if you do identify that a member you are serving has private health insurance, including an Act 62 benefit, you must submit claims to the private health insurance prior to billing Magellan HealthChoices, even if a denial was previously received for that service or a similar service. You will need to submit evidence of exhaustion of benefits or denials of coverage when billing Magellan HealthChoices. It's also important to remember that billing procedure codes may differ between a member's primary insurance and Magellan Medicaid. You should identify the correct coding when you're billing the private health insurer according to their fee schedule. And then when you're billing Magellan, you want to make sure that you're using the Magellan contracted code. So our claims department can reconcile an EOB from the primary with the claim you are submitting to Magellan, even if the procedure codes differ. If the service is not covered by the primary, it may be necessary to obtain this type of denial on an annual basis. Plans do change annually, as does the Act 62 maximum allowable amount. We have included here on this slide some helpful links that link to the last link on there to the DHS website will take you to a lot of helpful resources, including the procedure codes for Act 62 covered services, as well as Act 62 ICD-10 diagnosis codes. There's some additional helpful information, including FAQs and training documents about Act 62. And we also have some information in our Magellan Provider Handbook, and that link is also here. And I think, oh no, I do have one more slide, sorry. So my last slide today is related to Medicaid eligibility and some recent trends we've observed with members and their mailing residence addresses being changed. Before I get into that, just a quick reminder that providers need to verify member eligibility prior to and throughout the course of treatment. EVS is the DHS online system, which allows MA providers to check member eligibility in real time. There's some resources on this slide for EVS. And providers can also check member eligibility by calling Magellan. So now to the issue at hand. So at times, providers may need to assist members with updating their residence or mailing address with the applicable county assistance office. Magellan is actually not able to or authorized to update a member's address for the sake of their Medicaid eligibility determination or to change where all insurance and related mail is sent to. The only entities that can handle that are DHS and the respective county assistance offices. And here on this slide, you can see we've included the contact information for all of those CAOs. So the issue that we've observed, and mostly this is being seen in residential and inpatient settings, is that providers are helping members change their mailing and or residence address to the same address of the provider facility where they're located. And we just wanted to remind providers that this should not be done as a standard of practice, and it's causing some issues with member eligibility as well as where ongoing correspondence is being mailed. So as long as the member has a permanent living arrangement, a facility placement code should be entered into the eligibility record, which identifies the member's placement in a facility. And the CAOs can facilitate adding this code into the member's record. If necessary, and there's no other way for the individual to receive their mail, a member can temporarily update their mailing address with the CAO so that they receive benefit information while they're in placement, but the residence address should remain as their permanent address. The issue with this is that if their address is temporarily changed, it must be changed upon the member's discharge. And what we've seen is that some facilities that are changing a member's address when they're admitted are not changing it again when they're discharged. So they'll continue to receive UM-related correspondence and mail going to the facility for these individuals after they're discharged. And then there is a nuance for individuals who are homeless. The CAO does have business rules in place for these situations. Their member's mailing address might be a friend or relative's home, it might be a shelter, or the CAO can also use their office address if there's no other options. So again, it should not be necessary to use the provider's address in these scenarios unless the member requests it. But again, it will need to be changed again when the member is just discharged. So that should cover my compliance topics for today, and I'm going to pass it back to Mitch for some network updates.
Thanks, Carly. Carly, I think there might be a couple questions if you want to try to see if you want to answer those in the Q&A directly, or you can feel free to hop back on if you want to address anything live.
Sure, I will read through those now.
Okay. Welcome back, everybody, or welcome myself back here for presenting the network slides. I wanted to remind everybody after this final presentation today, we will be launching a poll survey to get some information from you about today's presentation and future presentations. So we will launch that at the end of this update. We will also be having an additional town hall in December. We will get the invites out to that, so look out for that registration. Network updates, these are a lot of reminders, but we find very important to make sure that we continue to bring this to your attention, so there's no disruption in service, authorizations, reimbursement. All of these are very important for daily business to continue. So at this point, everyone should be very well aware of the Availity system and be in the Availity system to be able to look up claims and eligibility. I think Availity we've been using for almost 2 years now, but I know has been in the industry for much longer than that, and a lot of providers have been using it for other business lines. I do believe there's a lot more that can be done in Availity, and in the future, I think we will be using some more through Availity. So we will always communicate before anything changes with Availity, but being set up and having your login and password will be important for any of those future activities as well. So if you're not set up with Availity yet, it is definitely a good time to make sure you get set up in Availity. We have information on our website, how to sign up and how to look up information like eligibility and claims information. Claim submission has not changed, so it's not going through Availity at this point. I know some providers have used Availity for claims for other payers. In the future, that may be something that will be allowed. And again, when that is available, we will communicate that to the provider network. You can access Availity Learning Center, and here are all the steps to take. Again, I encourage everybody, if you're not sure, to check that you have your Availity setup, login, and password. Hopefully everybody is already using it, but if not, this is a good reminder to get started Again, a lot more in the future will be used in Availity, but currently there are very important information in Availity with claims eligibility. So please go in there and make sure that you are set up and that team members that you want to access Availity are also set up. Claim submission, very important that claims are coming in timely and clean. We would like for all claims to be paid on the very first submission. It is best for our system to have claims paid and in the medical spend immediately. So it is great to keep an eye on some of the important steps of submitting a clean claim. Timely is obviously the number one factor to make sure you get your claims in on time. As Carly mentioned, that if you have a claim that has a primary coverage, TPL, that you want to submit your EOP with that. Again, the importance of getting claims in and paid helps future rate considerations and also for your value-based scores and incentives. So a lot of this is done based on claims payments that are in our system. So we want to make sure that you are addressing any claims that may have gotten denied to try to review those immediately and get those back in for adjustments. Place of service codes are very important. We are actually doing an initiative now to look through claims that are being submitted with incorrect place of service codes, and we'll be reaching out in the near future to providers to let them know if they are one of the providers who might be having this issue. Magellan has really supported getting claims through our system, so we may have been getting some of these place of services through, but we want to make sure that everybody is compliant and making sure they're using the specific place of service codes that are utilized for the codes that you're billing. You also want to make sure you're using your code and modifier combos on your contract in the order that they are on your contract, as that is how they are processed. So modifiers are important and must be in the order that's on your contract. Another reminder, and this is, some of the things that we add here each time that we meet are trends that we see and claims that end up denying. So you'd never want to use a member's address for the rendering service location that will deny. It must be the service rendering location where the services are occurring. So we did see this trending within the last year and wanted to bring it to everybody's attention. MA enrollment, obviously everyone must be MA enrolled for all the services that you're providing. You need to be enrolled and stay enrolled because there is a revalidation process every 5 years. So if you are needing to revalidate your enrollment, the state does send out several reminders to do that, and I believe it's within 6 months of your due date. So be sure to do that. Also, if you have any services that need Magellan's attestation, reach out to us in plenty of time before your due date so we can make sure that we give you the materials for you to revalidate in time. Obviously, if you lose medical assistance enrollment, reimbursement can be delayed. So keep an eye on revalidation. If you go into the Promise system, you will see a revalidation date on the bottom right-hand side, and it gives you the dates that they come up. And again, it's every 5 years. Updating provider information. So very important here as well. And again, I think also to what Carly mentioned with the compliance webinar and the provider town hall, is that we will be sending it out to the specific people that have signed up on our website. So we have contacts for the administrator, for claims, for compliance, for QI. You really want to make sure that you go in there and update all of those contacts so we can make sure that these specific communications go to the right people. You can go right online and update your information in our secure website. It is real time. and we will make sure that you are getting the communications that are targeted for those direct people. We would like also for you to go in and update this information on a quarterly basis. And as I go further into the presentation, you'll see about specialties and languages. That is also the same type of time frame we're looking for to complete that is on a quarterly basis. As we know, staff do change a lot with our providers. And if some of those are the ones that are the contacts, you certainly want to go in and update those so you get these communications going forward. All right, so how do you update your specialty information? So you go to the Magellan provider website. I think most of you are familiar with it at this time. The screen pops up. You have a username and password. You go in to select your TIN and MIS. We do have providers that have a lot of different locations. So you want to make sure it's specific to the location you want to update. You have specialties that you would click here. And then you go in and see all the listing of specialties that you can pick and that will be generated to reflect on the provider search tool. And why it's important to do quarterly is because sometimes these specialties are updated in our system. We have added some new specialties within the last 6 months. So it's important to go in there and really look through to make sure that all the specialties that your organization or group provides is updated. And that is just by going in here and looking through all of the different ones that pertain to your location. You also have this, you go into the service address, as I was mentioning, to be specific to the location, the rendering service location, to update all the information. Again, languages are on here as well. The Ukrainian language is highlighted because that was one of the more recent updates that we've made. When you go in and pick the languages that your agency or group offers, that will automatically also be reflected on our provider search tool, which would be great for referrals when members who have these language needs are matched up with your agency or group. And here is a list of our language preferences by county that we have reviewed and wanted to share with everybody. So you can see here the languages that come up: English, Spanish, and Russian in Bucks County, English, Thai, and Spanish in Cambridge. And Thai language is one that came up recently when we were going through the data, and that was one that was added to that language tool probably last year. So that's one you can see as well. And as we go through Lehigh, English, Spanish, and Thai, Thai again is top 3. Montgomery, English, Spanish, and Thai again. Thai is in there. And Northampton, English, Spanish, and Thai. So again, as we see languages populate, and we want to make sure that it is available to pick on our website, we will add that and we will let you know when they're in there. And on a quarterly basis, if you can please go in to include the languages, and don't forget American Sign Language, so we can best meet our members' needs and matching them up to your locations that have these specialties. Languages. Again, schedule routine intervals to provide updates, cultural preferences, and obviously the benefits to members. As you go in and update specialties, you will notice that with some specialties, there will be an attestation that launches. And what that attestation will do, it will ask if you meet special criteria to be considered a specialty in that field of service. And if you do meet those and you attest to it, our provider search will show an asterisk next to that specialty stating you attested to having that specialty. If you provide that service but can't attest to the specialty, it will still show on our provider search, and that is fine. But again, did want to let you know that if you do attest to these specialties, there will be an attestation that just says that you meet the special criteria. but that does not and should not stop you from entering specialties that you offer, even if it does not match up to that criteria. It will still be reflected. It just won't have the asterisk. Reporting updates and changes. Providers must notify Magellan in writing within 10 business days of any changes. Service, mailing, and financial addresses. A lot of these changes also have implications to enrollment, contracting. So if you have a new tax ID number, we have to make sure that that is updated in our system and our contract so you continue to get paid. Obviously very important. So there's a lot of information that has to be updated when there's a tax ID change. So you want to outreach to my team to make sure that we cover everything that needs to be updated. Also, you have the responsibility to notify Magellan of any of the following credentialing changes: license status, especially provisional license. So I know we bring this up, but I have it highlighted here. If you have an audit by the state, they're talking about a provisional license, you're going to challenge it, that's fine. Just let us know. We just want to make sure that we're aware as well. I'd like to hear from our providers as we partner with you to work through some of this. So again, even though you might be challenging, you might be submitting additional information, just let us know that there's potential for a provisional license, and we can talk with you about that. Again, moving services within 10 business days. You'll need to update your license, Medicaid enrollment, credentialing may be needed, may not, but when you reach out and let us know about your changes, we will certainly be able to tell you what needs to be changed and updated. And I'd say that the network does a really good job with this, but just wanted to make sure everybody is aware that the quicker you let us know about any of these changes, the better off you will be if there has to be contract changes, system changes, especially if there's authorizations. That takes a lot of time. If we have to change tax ID numbers or update MIS, Magellan provider numbers because of the change, the authorization process will take time to update, and we don't want to see any issue with reimbursement or delays in reimbursement. So the quicker we address this, the quicker things will be smoother and there will be no disruption in payments. This is our provider service contact information. So again, when we send this out later on this week, you will have this, and you can reference this or print it out to have, so you have these contacts readily available. This brings us to the end of the presentation. We are going to launch the poll survey. Really take a moment and fill that out. It will really help us for our next town hall, which will be in December. So we will send out the email blast to all the updated contacts that you put in right after this meeting to make sure that everyone can attend. Want to thank everybody for their time attending today. We definitely like the opportunity to update you on all the information we feel is important to you. And if you find information that was not presented today that you'd like in the next, please let us know on the poll. Thanks again. I will keep the presentation webinar open to give you time to complete the survey. Thanks again, and have a great rest of the day.